think some of the implications of this study is there really has to be a concerted effort to find out why are we seeing these uh, disparities and why is there such a divergence from the recommended treatment guidelines. A lot of the data is pointing towards knowledge gaps among the patients and also among the providers. And would it be surprising? No, because most of these patients are being diagnosed and treated in communities where the community oncologists have a heavy workload. They don't just specialize in one cancer, they see a wide variety of cancers on a daily basis in their practice. And for them to keep abreast with the latest technologies and the complicated treatment algorithms and the guidelines is almost impossible feat. So one of the things that we suggested is for these particular cancers where the diagnosis is such complex and challenging, and there are so many moving parts to actually making the decision to start a treatment and how to treat, uh, we recommend that when these patients are diagnosed with MDS in the communities, and especially if they are high risk, it might be beneficial for both the local community oncologist as well as the patient to get at least a one-time consultation with an MDS expert in a nearby, major academic center or a university hospital or a center of excellence or even a larger group practice that have MDS specialists, so that a proper plan of treatment can be formulated and then it can be executed at the local level by the local community oncologist, and the care can be shared between them and the specialist at a specialty center. I think that is a relatively low hanging fruit and can be done. And the second thing is, I think there's a lot of effort needs to be made for uh, making for bridging these knowledge gaps, because uh, to, it is still kind of puzzling as to why uh, more than 50% of the patients do not even get the recommended duration of treatment. And why are people not even getting the required 7 doses of azacitidine or 5 doses of decitabine in one cycle? Why are they stopping prematurely? One of the thoughts are we think is in MDS patients who already start with a low blood count. And when you start these treatments, these counts can worsen even more, meaning the patients can get more symptomatic from these low blood counts, especially hemoglobin. And you may see that in the beginning, 1 or 2 treatment cycles, they may actually require more uh, blood transfusions than they ever required before. It gives us a it gives us the optics of that the disease probably might be worsening, but actually that is not the case. It is an expected course of treatment. It is expected from the treatment that the counts may get worse and the transfusion requirement may get worse in the beginning before things starts getting better. And we have a hunch that uh, these might be the reasons where patients might be getting prematurely removed from their treatment, depriving them of the full benefit of the treatment. So some of the thoughts that we have, but these will require additional studies to further investigate in a granular way.